guys in the corner here. Okay, so hi guys. My name is Dr. Sarah Ramzan. So I'm a family physician, I'm an advanced cosmetic injector, and I'm a medical director. I'm probably going to give you guys a little bit of a different perspective, I think, than maybe what you guys maybe get in another way. So I'm currently in Canada, so I might have a little bit different of experience. Kind of, I think most of you guys might not be from here, but anyways, I'll try to kind of give some like general knowledge. And I just wanted to thank Medical Marvels Official for having me talk to you guys all today. So this is a little bit about who I am. I am currently living in Toronto, which is in Canada. And the picture you see on the right is actually from the Rockies on the west coast of Canada. I did my biochemistry degree from the University of Ottawa, and I did my medical school also from Ottawa. I then went to do my training in family medicine at the University of Toronto, and things I like to do outside of work is traveling, which I can't do very much of during COVID. And I love singing and dancing, and I speak 3 different languages. At the bottom of most of my slides, I'll have some clinical pearls. Hopefully they're just things that kind of like stick out and are kind of helpful. Let's do this up a little bit. Okay. Oops. Okay. So I always wanted to be a doctor, or something that was kind of something that I felt like very passionate about. My favorite class in high school was biology, and in particular, when we got the opportunity to dissect a fetal pig, I was like, okay, I'm all in. I also wanted a career that could allow me to help people out. So it was kind of like, seemed like a nice blend where I could use my background and interest in sciences, etc., and to kind of use that with my desire to help people out. Initially, I wanted to be a pediatrician, but then I kind of changed my mind, and I'm really happy with where I ended up. If I could give myself any advice, if I was to look at myself like 10 years ago, would just be to sort of tell myself that it's okay and normal to be confused throughout the process. And even as I went through, like going from being an undergrad all the way to where I am today, there was lots of moments where I just kind of got confused and didn't know where I wanted to do, or, didn't know if I was in the right place. So that's totally normal. And, I think what I would tell myself is also just to kind of like see where life takes you and just be open to different experiences. So in sort of like your application for medical school, they actually look at what you do in high school. So, I think it's kind of cool that you can kind of incorporate things that you already like to do in your application. In high school, I did Taekwondo, I played the piano, I did recreational badminton. I worked at a language school on Saturdays. So my mom was a teacher there. I worked in the office doing some admin stuff. And I did that like 4 hours a week every Saturday from the age of 14 all the way, I think, till I was like in my mid-20s. I also was involved in a lot of school committees, and I volunteered at the hospital. So it was a very big academic keener. So I was like very focused on doing well in school. But I guess my advice would be that, yes, your academic performance is probably really important, but beyond that, I think it's sort of like they're looking at who you are overall as a person. And so, doing things outside of medicine is also really important. So I would just pick things that you like to do and are kind of enthusiastic to do. And I really just think that, your marks are just not the be all end all. So in terms of when I was doing my undergrad, I ended up switching my major in my second year. They were pretty similar. I started off in biopharmaceutical sciences and I switched to biochemistry. And the reason I switched was kind of 2 reasons. One was I didn't like organic chemistry as much. It just didn't really come as naturally to me. And so biochemistry had a little bit less of that. But also the biopharmaceutical sciences degree, we had to do a class on ethics. And I ended up doing really terribly on one of the essays, and I ended up dropping the class. And so I kind of was, it was one of the things that you had to do for that degree. So I ended up switching my degree and being much happier for it. But kind of teaches you that, like, you can still have kind of like challenges along the way. I, didn't do very well in that class at all, but still ended up with a really high GPA overall in university. So I guess, again, sort of like goes back to the same thing, which is it's okay to kind of make changes and kind of see where life takes you. I ended up staying in the same city where I was living. So my parents brought me with this car that you see on your right. It's a Ford Taurus 1996. It was an old car, but allowed me to be really independent. And so I kind of agreed to stay at home. For me, it really worked out really well, just because I could really focus on doing well in school and doing other activities rather than having to do things like groceries and cooking, etc. But I think everyone is so different. I mean, some people really thrive on kind of having that independent experience. So if that's your thing, I think that really works out. For me, this is kind of how it worked out for me. Definitely helped out with being able to apply for different scholarships, kind of monetary wise. But yeah, essentially it was kind of a interesting route to get to where I am. So in my application for medical school, obviously I had to write the MCAT exam. So it's like an entry exam. And again, everyone has their own way of like what they'd probably advise. I was sort of someone who enjoyed studying on their own, and I didn't really want to be in these like bigger classes. It just didn't sort of like retain information that way. So I really studied on my own. Kaplan was a big company that was like doing the medical school MCAT preps. So I got some of those books and I just practiced on my own. My biggest advice would be to like do like as many practice exams as possible. The practice exams are like what the actual exam will look like, as opposed to the theoretical stuff that you read in books is important. It gives you the good like sort of like base to start with, but it's really important to be able to actually see what the exam is going to kind of be about. Actually, now that I'm on Instagram a little bit more, it's kind of interesting. There's a lot of like feeds that actually talk about like MCAT exams and like how to prepare for them and like the types of questions. So I think there's so many more resources out there than when I was doing it. So I'll probably date myself in that I wrote the last paper exam, and I also wrote the first computer exam. So that was when the MCAT was being switched over from paper to computer. So I wrote the MCAT twice. The first time I wrote it, I got a pretty good score, except for in like one category. And so I redid it again just to kind of like up my mark. To be fair, I kind of did about the same the second one, but I got a little bit better on that, the part that I didn't do so well on the first time. In terms of like timing, I spent about a summer preparing each time, one between my second and third year and one between my third and fourth year of my undergrad degree. I ended up getting lucky in sort of getting some research opportunities. In fact, in first year of my undergrad, I didn't really want to do anything. I just wanted to take the summer off. But my dad's friend's friend was looking for someone to help out with doing some like data collection in the ICU. So I sort of like took that as a great opportunity to sort of like learn. And you learn a lot about sort of like the scientific process and that kind of thing. So I thought it was pretty helpful. And I got 2 research scholarships in the summer of between my second and third year and my third and fourth year. And again, that really kind of, I think, really helped out on my resume and application to medical school, but I don't think that it's always absolutely necessary. There were a lot of people in my class who were not science background, who didn't have science backgrounds. So people who were like engineers or people who were like English majors. We did have someone who was like had a couple people who were like nurses who had kind of come back and wanted to become doctors. So I don't think that you necessarily like have to be in a science field to get into medical school. Obviously, it's just easier because you do all the prerequisites and it's just easier. So in terms of like writing your personal statements and references and sorry, and getting references, I'm sure that, it varies like school to school, etc. In Canada, it probably really doesn't matter where you do your undergrad as much. I know some parts of the States, it's probably more important. There's also very few Canadian medical schools, so it's quite competitive here. When you're writing your personal statements, there's basically like it comes in different forms, but essentially like some sort of like essay or some sort of like written description of sort of like why you want to get into medical school, that kind of thing, and a little bit about who you are, your background. So I like to say that you want to sort of like paint a picture of like who you are. You can say like, I'm a great communicator, like I'm really determined, I'm really like really focused, but like it's sort of like a lot of people are going to write very similar things. So it's like, how do you sort of stand out? And so that people, when they read what you write about, they're kind of like, this person sounds interesting and I'd want to get to know them better. So, for example, I mentioned I worked at like a language school like once a week, and so what I did was I used that experience a lot in a lot of my personal statements. So I worked in a community where there's a lot of like immigrants, people who are didn't speak English, and so I talked about how it taught me about like better communication, better tolerance of people. Like I had to register people who didn't speak English. So how do you communicate with people in other forms using like nonverbal cues, etc. So it isn't necessarily that you have to use like medical experience, like working in a hospital, etc., to write about. You can use kind of any of your experiences, and I think that especially anything that you've kind of been consistent with, where you've like spent a lot of time kind of being passionate about, I feel like that it tells a lot to someone about kind of the person you are, speaks to your kind of character. Same thing when you're trying to get references, you want to get someone who knows you well. So I asked my research supervisor, so I'd worked with the same person for 2 summers, and the work supervisor, like the place I just mentioned, every Saturday that I went to, and I asked a professor that was in one of the smaller classes that I attended. There's like a class of like 30. So it was pretty intimate. She knew like all of us pretty well, and I had done well in the class. And I asked her if she could be pretty confident in being able to write me something strong. And she said she was. So now you're kind of into the process of trying to like, interview for schools and, it's, to be honest, these kind of like tips I would say are like useful for like any type of interview that you do. So whether you choose to kind of go down this path of medical school or not, really being yourself is kind of the most important thing. It sounds very obvious, but it really just is, I think, my best advice. Yeah, I got an interview in my third year of my undergrad, but I didn't get in. I got 2 interviews in my fourth year. I got waitlisted at one university, and I got straight into the university where I ended up going. I would say that you want to find out about the style of the interview. So one of the ones I went to was just like one-on-one with the interviewer. I had one where there was like a panel of people. There was like 3 or 4 people there. And then I had one which was like almost like mini stations where you were like asked you were given a little blurb and you had to actually like either like answer a question or kind of like do work in some sort of like interactive assignment. So it was kind of very different. So obviously knowing the style of the interview is important, knowing what, which school you're kind of applying to, what are they like best known for, just kind of, you just want to be prepared as like for anything. This would be whether you'd be, again, doing any type of interview. Our school had lots of workshops to kind of help with interview preparations. To be fair, I never really went to any of them. I think I was a bit shy and kind of reserved, and I just didn't feel as comfortable putting myself out there wanting to do practice stuff. So I did it mostly just at home in front of the mirror with family, that kind of thing. But I would actually recommend having someone like professional actually like watching you as you do interviews. I think you can learn a lot from it. And, that would be something that, again, it worked out for me, but I would probably I would have changed that and maybe done that. In Canada, at least, the interviews usually have an ethics component. I feel like most places probably do. This book was just Doing Right was one of the books that was like the holy grail in terms of like how to prepare for ethics questions. And so, most of them are just like, you have sort of like a sort of a difficult scenario and like, how would you work through the problem? And whether you're, again, doing an ethics question on a medical interview, or you can get an ethics question, again, in any type of interview you do. One thing that kind of really helped me out, and I actually use this on my interview, was I got a bit stumped and I said, that's a great question. Let me just think that one out loud. And I kind of like went through the scenario of the question kind of out loud. So I said, well, on one end, blah, 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 blah. And on the other end, blah, 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 blah. And then as I was sort of saying this stuff out loud, I kind of realized what I felt like the right answer was. A lot of ethics, there's not necessarily a right answer, but regardless, I was like, I realized I was leaning towards one side. And so then I could kind of really give my reasons for that. So, I mean, that's one tip that really helped me out. Interestingly, on my medical school exam, I was talking about my research project, and the interview was happening in the same building where I was actually doing my research. So I kind of made a comment that, like, after this interview, I have to go back up and finish my project because I don't want my cells to die. And I guess the interviewees thought that was kind of a funny joke. It wasn't meant to be a joke, but anyways, they thought it was funny. So I went with the same joke at the end of the interview as well too, and everyone kind of laughed. And I guess it sort of made me feel like, okay, I think they kind of like me and stuff. And that's obviously the school that I ended up getting into. You can use comedy, or not, I shouldn't say comedy, but a little bit of humor, but it's got to be really tasteful. And to be fair, I didn't really I wasn't trying to be funny, but it kind of worked out in that way. And it kind of, I think, helped them kind of see a little bit of my personality. So now you've gotten in, so yippee. So now what? So we're getting into some interesting stuff. So my medical school experience was kind of interesting. In first and second year, you're mostly doing classes. We did some like problem-based learning stuff. So that would be like, I don't know, Alice is a 41-year-old female. She's got asthma and she's got like difficulty breathing. So like, what would you like to know about her? So this is kind of a way to like learn about like how to interview patients and what kind of questions to ask. So it kind of, instead of being very theoretical, kind of gave like, us a little bit of practical experience, even though it was still like in a classroom. In third and fourth year is when you start to do your like clinical rotations, which means that you're kind of going around to the hospital and you're like, joining different doctors and like, doing surgical specialties. You're helping to deliver babies. You're working on the medicine ward, just seeing like a lot of sick people. For me, I think I had a little bit of imposter syndrome at some point, probably like I think in my first year of medical school. As you can see, I was pretty smart in the sense of like I had a good GPA, but I was with a lot of really smart people, and these smart people, they didn't necessarily need to study as much as I needed to. And they were pretty naturally smart and they could just like regurgitate information, whereas I had to kind of work a little bit harder. So, I mean, there was points where I wondered if I'm like in the right spot. Do I deserve to be there? All pretty normal, to be honest. I think that's even in like all aspects of life. You kind of go through there kind of wondering if you're like in the right space. Even in my third year, the very first time I went and did an emergency rotation, I ended up having a doctor or a preceptor I worked with who was like kind of mean. He didn't really give me a lot of like basic instructions, and then he kind of just yelled at me a couple of times, and I just like felt pretty like defeated because I was like, I knew I was able to do more, but like he didn't really kind of help me in the way I kind of needed him to help me, just to orient me, for example. So I remember calling my mom in the middle of that day and being like, like I'm like, I don't know if I'm supposed to be here, and kind of like being really upset about it. But I mean, we had a chat at the end of the day, and like, he sort of gave me some pointers and I sort of like gave my feedback. And ironically, the next shift I had, I worked with someone who was like super compassionate and was very like, kind of like held my hand through things. And so I just realized, yeah, you know what, I can kind of do this. And pretty much after that point, I realized like, I really am capable of doing this. And you end up working like on call and doing overnight shifts, and you learn a lot about yourself, learn a lot about how to take on difficult situations. And in a way, now there's very few situations that kind of gave me a lot of anxiety, just because I went through a lot in this whole process, and it does teach you a lot. My recommendation would be to sort of like, if you're at the stage, or again, I like to give a lot of life advice, but it's basically just to sort of like be open to different opportunities. Um, I did a lot of electives in different specialties even before I got into my third year. So just because I just didn't know what kind of doctor I wanted to be. And, I ended up really liking a lot of surgical rotations. And in fact, a lot of the doctors I worked with were like, you'd make a great surgeon. Whereas like it was something I'd never considered doing in my life. And so I ended up not choosing surgery just because the lifestyle is pretty challenging, and it wasn't something I was didn't think I was that passionate about to sort of continue doing. But it really opened my eyes to realizing that I kind of enjoyed some um, like hands-on stuff, which kind of alludes to how I ended up becoming going into sort of cosmetics and stuff. I ended up doing, again, some research in medical school. Again, it wasn't a little bit by fluke again, and eventually got published. I think that you don't necessarily have to do research, but obviously, anything that's helpful on your resume kind of always works out. And sorry, and last one was just, there was a lot of people who sort of came into medical school or even before medical school who were like, I want to be a cardiac surgeon. I want to be like a heart doctor. And they were like obsessed with wanting to do this for whatever reason. And a lot of them didn't end up choosing what they thought they were going to choose, not because they didn't get into it, but because they realized that they liked something better. So I just think that like, it's better to go in with an open mind and rather than be like totally stuck on one specific thing. So now I'm going to talk a little bit about like why I chose to go into family medicine. Like I said, I did want to be a specialist. I first thought I wanted to be a pediatrician because I loved kids. Then I kind of realized like I didn't really want to see a lot of really sick kids. Then I was like, well, I really like, like skin, and I was really good at sort of like pinpointing rashes and stuff. I was like, maybe like, yeah, I probably could be a dermatologist. The problem I had was that like in every specialty I sort of like tried out, it kind of got a bit bored. And I was like, well, could I just really see myself doing this for the rest of my life? I thought being a specialist would be easier because you just have to know like a lot about a specific topic, whereas like something like family medicine, you gotta need to know like a lot about like a lot of things. So just thought it was more daunting. But for some reason, I went to this talk about, what you can do with family medicine outside of just like, being a family doctor in a clinic. And it was like you could be in the hospital, you could be a hospitalist, you follow some of sort of sick patients, you could deliver babies, you can work in the emergency department, you can be work as like a family medicine anesthesiologist, which is someone who like works at sort of like an anesthesiologist, but like you have to get proper training for it. There's just a lot of options out there. You can do palliative care, that's end of life care. So I just realized, what, I think this is sort of like where I see myself going. I also, had such a focus on, I loved kids and I thought that's the like population I really like, but I interacted with some of the elderly and they're just so cute. They tell you like the best stories. And so kind of realized that that was something I wanted to sort of incorporate. So I wanted to see people of all ages. So I think I have like newborns all the way to someone who's like 101 or 2 in my practice. So it's really big range. What I also like is that you get to practice preventative medicine. So it means that like, you get to see how to like tackle problems before they actually become real problems. Like for example, someone who's pre-diabetic, like gonna be like their sugars are high, but like how do you like get them to sort of like lower their sugars and not become a diabetic? And also you get to like follow people and really get to know patients. So for example, if you work in the emergency, you'll see the emergent situation, and then after that, you probably never see that patient again. So you don't really know what happened to them. So if you don't really care about them, that's fine. Like, again, I think that everyone is designed to be a specific type of doctor for a reason. I don't think I liked acuity that much. And, I was just curious. I wanted to know what happened. So in this way, I get to like know the full story about the patient. Okay, they went to the hospital, then this happened, and they come to follow up with me. I've seen some kids from the time they were born all the way till like now I think I'm 6 years in, so till they're like 6 years old. And it's kind of cool to see like, people kind of evolve over time. So I think it was like well suited to me. Plus, you could tell I like talking, so this is like perfect practice for me to be able to like talk to people all day. In Canada, the residency program is like 2 years. In the States, family medicine is 3 years. I mean, to be honest, the like it's obviously like less time than doing a specialty, but that's not really wasn't really my reason why I chose it. Like I said, I think all the other reasons were more important. It just happened that it was a little bit less time, kind of thing. So in my family medicine residency, like I said, I moved to Toronto. So I lived in Ottawa, which is like the capital of Canada, a little bit of a smaller place, and I moved to Toronto, which is a bigger metropolitan city. But I chose to kind of work in a community hospital, which is a little bit of a smaller hospital. It's mostly run by family doctors. And I guess I just wanted to work more closely one-on-one with, the doctors. Sometimes we were just me and the doctor. Whereas if you ever watch Grey's Anatomy or any of the equivalent shows, you'll see like they have like the medical student and they have the senior medical student and they have like the resident and senior resident and fellow and doctor. And there's this like big hierarchy that you'll see. Didn't have as much of that hierarchy here. So I, didn't have to experience as much of that. If you work in Toronto or for example, any city, but like work in most of the downtown hospitals, you would have gotten more of that experience. Again, I just think that it was just something that's better suited towards my learning. I got to do a lot of procedures. Biomedicine actually has, you get to do like knee joint injections. You get to insert IUDs. You get to suture. You get to do warts, treat warts, skin removals, lots of things that you could do. So it's, kind of like never really a dull day. In our residency, we had to do 2 months in a rural area. That was kind of interesting too. Like you want to order a test, well, forget it. That test, you want to order a CT scan, they don't have it, or they don't have it overnight. So you have to figure out different ways to kind of like treat people without the normal tools that you normally would use. Ironically, when I was young, I just thought that family doctors dealt with cough and colds all day. So I was kind of surprised that like that's a very, very, very minor part of my day. And so I've always found that like there's so much more to family medicine that I think that people sort of see. I obviously had to do some licensing exams. In Canada, there's called the MCCQE. I know that you guys, if you're in the States, you do the USMLEs, or most places will do USMLE. So I never did the USMLE. It's a little bit different, but the concept is sort of essentially the same. Like in any kind of like experience where you're about to go out on your own, you want to take as many opportunities as you can to sort of like ask questions. I was always kind of a bit nervous to sort of like come out as being dumb, but what you realize is that when you go out and practice on your own, you kind of like wish you asked all those questions. So again, regardless of like what you end up doing, don't be afraid to ask questions and kind of get an understanding, because at the end of the day, you're eventually gonna have to do it all on your own, and you might as well be well prepared for it. So now you are, you're done all your exams, and now you get to work on your own. So kind of a little bit daunting in the beginning, but I realized once I got through my first day that, I can get through any day. When I was trying to find a job, there's different ways of trying to do that. I got really lucky. I worked with some doctors and their friend was going on maternity leave and they were looking for someone to take care of their practice. So I did that. But I also had like, a couple months which I needed to find some work. So I came to this clinic where I currently work at. And first I was like, yeah, I don't really think I'm going to stay here. It's a population, it's a little bit challenging, low socioeconomic area. So, didn't know whether I would like it or not, because my training was with like in a very like affluential area. Everyone there was like pretty well off and rich and all this kind of stuff, very different. But I kind of realized I really enjoy dealing with sort of this like a challenging population. And sometimes you would tell them like just about Tylenol and how it helps out with headaches, and they'd be like, "Wow, that's like really surprising to them." But also, where I worked in my training, I could like prescribe any medication. Now I would try to prescribe the same medication, and the patient would just tell me like, "Well, I can't afford this medication." So in fact, I kind of had to relearn how to practice medicine actually when I finished. And I had to learn to kind of like target it or like gear it more towards the patient population I was working with. In Canada, we kind of have like you call it free healthcare, which is not really free. It's just that we pay taxes towards it. So the good thing about that is that we don't have to really worry about like the cost of things. And I'm not trying to like chase people down for insurance and that kind of thing. So I can really just focus on the medicine aspect, which is really nice. Another thing I learned as a family doctor is that patients really rely on your opinion. So sometimes I'll say like, you know what, like this, is kind of out of my area of expertise. You should go see a specialist. Some people will refuse. It's like, well, I'd rather just see you. Or if they see a specialist, they'll say, well, the specialist said this, but I want to know what you think about it. So you realize that like your opinion is really important to them because you form this like really important therapeutic relationship with your patients, which I think is really kind of cool. But as you're kind of going through this, you're thinking like, well, like now you're out on your own, you have to do all the stuff by yourself. But to be fair, we have a WhatsApp group with all of the people I graduated with. We still ask each other questions, and it's been like 6 years later. So what's kind of cool is that, despite you thinking that like, you have to know the answer to everything, no one has the answer to everything. So, it's okay to be able to ask other people, even at this point. And so, it's nice to kind of have that support. So I'll talk very briefly about this. Again, you could, at the end, if anyone has any questions or they want to ask me about anything, you're more than welcome to. But the clinic I currently work at, I mean, they were able to they had space for me essentially 3 times a week. So I was looking to kind of do something for, the other 1 or 2 days. And like I said, I kind of realized I liked some procedural work and I kind of liked some, aesthetics and dermatology, etc. So I took a course and then I emailed different companies and found someone who was willing to sort of like take me on. They trained me, they did some extra training or gave me extra training, and I started to work there 1 time a week and doing some remote consultations on another day a week. And 1 year ago, they sort of asked if I could be their medical director. And so, kind of not at all the way I kind of expected things to sort of go. It was sort of like a little bit of a fluke I got into this, but something that I really enjoyed. And it's very, very different than what I do as practicing as a family doctor, but I kind of really enjoy it. It's kind of like a slightly, like, I guess you use different skill sets. And I think it really like helps me, kind of opens up a little bit of a creative side that I have. So again, like I'd say, like in my like life, pearls would just be to be open to things happening, and like, sometimes you try out things and don't realize you're going to like them. And so if you take the initiative, it kind of sometimes pays off. So this is what a typical day kind of looks like for me. This is like during COVID. So on Monday, I do some virtual consultations for the cosmetic clinic. So I'm mostly just calling patients and sort of like seeing if they're like good candidates for certain procedures. I'll do some like paperwork. It's kind of a little bit of a catch-up day for me. If I need to like get out and do some errands during the day, it's a good day to do that. Tuesday and Wednesday are pretty similar. So I'm basically calling patients all day and, trying to deal with their issues and through the telephone. Kind of interesting. I'll talk about like how that's different than real life or being in the clinic. And pretty much every day you'll see I'm reviewing lab results. So that's like, when someone goes to do a test, now you're responsible for the blood test or the, let's say like they did an x-ray or something like that. So now you have to spend the time kind of like going through that and like figuring out what you want to do as a next step for this person. Thursday, I'll actually go into the cosmetic clinic and I'll actually, do treatments for people that day. But to be honest, even when I come home on a Thursday, I actually go back and try to like review my results just to see if there was anything important that came up. Friday, I'll actually go in for half a day to see my family medicine patients. And the other half of the day, I'm just doing some like virtual telephone calls again. Our clinic is really trying to limit how many people actually come into the clinic because of COVID. So it's very limited, but I'm really surprised that telephone calls are actually quite effective, interestingly. Saturday and Sunday, like I'm, generally technically off. I'm not really dealing with any patients, but again, I'm doing some like, paperwork or some stuff that like I didn't really get to during the week. The thing with family medicine is that you can really work as little as or as much as you like. I kind of have like two full-time jobs, and it for me it's sort of manageable, and I like doing it. And it's COVID, and there's not really much else to do. But if I wanted to cut down on any of those two things, there would definitely be opportunities to do that. So I think that's what I really like about it, the flexibility. So in terms of doing like virtual consults, so obviously you're like calling people, you can't see them. A lot of my patients don't really speak English very well, so like trying to understand them sometimes is a bit challenging. You can get a translator, which helps, but sometimes you're kind of a bit confused as to what some people are saying. If there's something like a rash or something, you have no idea. Like they can kind of describe it and you can maybe figure it out, but obviously a picture is much easier. So I'll get people to like send me pictures. I can email them, lab requisitions to like go do their blood test. I can fax prescriptions to the pharmacy so that like they don't have to necessarily come into the clinic. So a lot of like, ways to go around, having to see people. If anyone has any COVID symptoms based on what I hear on the telephone, I said just tell them to go to a COVID testing center, or if they sound really bad, to the hospital. If anyone has anything that sounds really concerning, I'll send them to the hospital. But to be fair, even in COVID, I think I've maybe sent like 2 or 3 people to the hospital. And really, it's not that people aren't going to the hospital, but amongst the people that I've talked to that I've been concerned about, almost everyone else, I can kind of find a way to treat them remotely. There's some people that you do have to have come in, diabetic, I haven't seen all year, and I might need to check their blood pressure and that kind of thing. So I'll see them. People who need to come in, like babies who need needles or immunizations, I'm bringing them in. So it's a little, a bit limited, but just trying to, keep everyone as safe as possible. And anyone who is like coming in, we're screening them, and we're making sure that, we're like fully protected in terms of PPE, etc. So the real goal of the telephone things is like to really make sure you rule out anything that's an emergency, and then try to see how you can try to solve the other problems. So this is what like a typical day kind of looks for me. I'm usually in clinic. This is like prior to COVID, I'd be in clinic between 9 and 4. So I'd see people between 9 and 12, and then take a lunch break, and then start again at between 1 and 4. To be fair, a lot of times I work kind of halfway through my lunch and like checking labs and stuff like that. So we don't really get paid to like review labs. So it's like just trying to be efficient. And if there's something like a more emergent, I can then like call the patient and like sort of talk to them. So this, like I usually see about 24 to 30 people per day. That's 10 to 15 minutes per person. Varies. Some people like they're just coming in for prescription renewal. Takes me a couple of minutes. Some people come in to talk to me about some really heavy stuff. I might be in them talking with them for like 20, 30 minutes. So it really just varies. A lot of what I typically see is a lot of babies. I have a lot of babies in my practice. Good amount of pregnant patients who are having these babies. In my population, there's a lot of diabetics, a lot of people with high blood pressure, and a lot of mental health, which I think you'll see a lot of. So the thing with as you're going through your day is that like I said, if you're like unsure, you can always refer. The other thing is if you're not quite sure about how to deal with a patient, you can always just tell them to come back. Most people are actually really willing to sort of like come back to see you even like in a week or two, just to kind of like touch base again. Obviously a little bit more difficult with COVID, but in general, this is kind of the cool thing about family medicine, because you could just like have people come back in and just follow up with them. So I just wanted to go like very briefly about like the types of people that I'll see in my practice. So just to kind of like, instead of a little bit of theoretical, is actually like give you guys some like more practical kind of thoughts. So I have like a 50-year-old patient in my practice, and he's diabetic, and he just kind of doesn't really believe he's diabetic. He doesn't really want to take care of himself. His sugars are like double what they should be. He doesn't want to see a specialist. So it's like, how do you deal with these type of people? Like, how do you get them to, just take care of themselves? And I think part of this thing with medicine, you realize with time, is that like you go in really like enthusiastic. I'm going to like, solve everyone's problems. But you realize that some people, they don't want their problems to be solved. And so you can't force them to like, necessarily take any treatment plan. But, with a lot of these people, like some of the people like this, I've actually been able to convince. It's just, taken a long time with trying to like tell them like, the downsides and trying to create a good relationship with them. But you realize you can't really solve everyone's problems. If someone who, like a 25, so young lady, she's got a borderline personality disorder, it just basically means that she's got like a mental health illness, and she tends to be, I guess the best way is sort of like pretty needy. She does have lots of medical conditions. She sees like probably like 10 different specialists, but like every time you talk to her, and sometimes you'll talk to her like 2 weeks or 4 weeks, she's always got new problems, and there's always like a list. It's always like this and that and that and this. Whereas like as someone who, I barely go to see the doctor myself, it's really interesting for me for someone to like constantly coming in with like new problems. And how do you kind of, still give her the validation she needs, but like don't kind of like egg her on, because otherwise these people can kind of like take more and more time worrying about their health, whereas they should sort of, some of these problems may be a little bit more of what's sort of like construed in their head, or they're not necessarily made up, but they just kind of like make them a much bigger deal. So there are definitely some challenging people you deal with. One of my favorite stories was this gentleman who came in. He's like a diabetic patient. He had a heart attack like maybe like a month or two ago, and they did this like procedure where they like took a piece of his they did a graft and took a part from his, like an artery from his leg, and put it into his heart. So he's just recovered from that, and he basically comes in, and my population has a lot of Jamaican patients. So he comes in and he goes, "Doc, there's a wiggle in my leg." And like for a lot of people, like I thought it was like a nerve problem, like he had like some like nerve damage or something in his leg. So it's like, okay. And so anyways, he had a band-aid on his leg. So I was like, okay, let me have a look at what it is. And I removed the band-aid. It was a little bit bigger than a band-aid, but and I looked, and there was a little hole in his leg, and in the hole there was like a little bug in there. And I was like, and I closed it up, and I was like, okay, interesting. So I had a student with me that day. So I was like, no, this is not a usual thing. Anyways, turned out he had a maggot in his leg. And so I was a little bit really anxious, because this was like right where he had surgery, and like I was really anxious. So anyways, I told him he had to go see, like a wound care clinic to keep an eye on this thing. And he was like, "Doc, it's too far away." Even though the hospital or the clinic was like 15 minutes away. So I was like, okay, like if you won't go to do that, at least come back to see me. So I saw him a couple of days later, and interestingly, because maggots actually get rid of dead skin and inflammation, so his the hole in his leg was much better, and actually it was like healed up. But I remember that was like one of the most bizarre things. I didn't think that the wiggle in the leg meant that there was a maggot in his leg. I also have like a 101-year-old patient. He's like pretty healthy, barely has any like medical conditions. He like goes line dancing. I'm not sure, probably not in COVID, but like he just dances every week. So, there's just like such a wide range of people that you see. So some of them are challenging, but I think the whole process is pretty rewarding. I'm almost done, but I just wanted to touch base about like, if I had kind of known, like if someone was really honest about what they thought were like not like reasons to not go into family medicine. I think there's a lot of paperwork in family medicine. So I do spend a lot of like evenings and weekends like doing work. It'll be like, someone needs a sick note, someone who's like applying for disability, they need a letter from their doctor, someone who's like applying to nursing, for example, they need to make sure all of their immunization records are up to date, they need a letter from their doctor. So I fill out a lot of paperwork. And I understand why people have doctor writing, because my normal writing is very nice, but my doctor writing is not very legible for that. I think just because of how many forms I have to fill out. The other thing is that, specialists will just, say, well, you know what, go see your family doctor. Sort of a way for them to kind of, put the problem back in your court. So sometimes it's a bit annoying that like, like you send people to see a specialist to see if like they can try to take care of a problem. And if it's sort of out of their expertise, they bring the problem back to you. Sometimes a bit annoying. Sometimes I just feel like for some people, like I'm a referologist, basically just means that like certain people just only want to see specialists. Like, if someone has acne, like I can deal with people's pimples. But they're like, no, I need to see a dermatologist. And they haven't even really tried basic things that I can probably do. So sometimes it's kind of annoying to be just like someone who's referring out type of thing. Not super common, but still kind of annoying. Some people may say that family medicine doctors get paid less. I think it really varies. I'm sure it varies in like place to place, but like some of the doctors I work with like do a lot of hospital work and they deliver babies and they do a lot of things. And so I feel like they're pretty comparable to specialists. Although like if you're going to compare like a, surgeon or like eye specialist or something, like it's not going to be in the same realm, but they have to go through longer training, etc. And so I think it's hard to compare the two. Sometimes challenging patients, especially like, mental health patients, can be really draining. I find some days like, I have empathy drain, which basically means like I just can't be empathetic anymore. I understand your problem, but like I need a break from people just constantly like telling me their problems or complaining to me. So sometimes, you need, I find with family medicine, you need sometimes a bit of a mental break. But I mean, I guess like with anything, you have to accept the good and the bad. Like if I was to sort of still go through the process, I pick family medicine every single time. I don't really have any regrets. Yeah, these are things that are kind of like not always perfect, but I still find like the benefits I get from it and like the rewards I feel I get and the ability of like how much I'm able to help people out, I think really outweighs everything else. And I think it's my last slide, but like really what I wish I knew overall, this would be like sort of like concluding statements, I guess, that like, like just like anything, like life is sort of like a journey and, there are good times, bad times. Like I tried to highlight a little bit about like some of the challenges I went through myself and like, not always feeling like I deserved to be here or knew where I wanted to go. It's really taught me a lot about myself. And I think, people's 20s or in that decade, I think is such an important time to learn about yourself, what you like, what you're not like, and like so I just say like let things happen as they happen. Most doctors are kind of like type A OCD perfectionist, so I was always really like trying to control things, and the more I let go of things, I realized like the more things just kind of like played out in the way that they were supposed to happen and in the best way possible. So no regrets. As doctors, as lots and most medical professionals, we're not very good with money generally, just because we're not really taught about it like the way that people in business school are. So just don't be afraid to like get some help or learn yourself. There's lots of like, self-taught books in terms of like how to be good with money. We're not taught about how to like run a practice. Like we're actually self-employed. So like that means that you're like a business owner kind of sense, or like you're doing stuff, you're not an employee. So like how do you deal with all the like money aspects or like like incorporating and all, there's so many aspects of that I like only learned way later, that I wish someone had kind of like taught me. Like I said, it's pretty rewarding field, but obviously a lot of work to do. I would say that like if you can keep on doing the things that you can outside of medicine. I like really enjoy the like spending time with family as much as I can during COVID. Like I said, like enjoy singing, dancing, traveling. I can't do as much of, but like writing, like anything that I like yoga, like anything I like to do outside of medicine, I've been trying to do as much of. It just keeps sort of your sanity and keeps your balance. And obviously, like people in your life are big supporters, are super important just to keep you kind of like grounded and stuff. And I would just say to try to live life to its fullest and practice a lot of self-love. We kind of, especially in the medical field, put people first. And it's just important to be able to like take time to sort of realize that you're a person too, and you have limitations, and just be able to kind of focus on yourself as well too. So, I mean, just to really say this is like how everything turned out. So I did 4 years of undergrad, 4 years of medical school, 2 years of residency. So it's like 10 years total. And like I said, I wouldn't change a thing, but that's kind of like how long the process is. Family medicine in the States, as I mentioned, is 3 years. So it's a long process. So if you're kind of like worked up or just like really uptight, it's really hard to kind of like get yourself through that many years. But at the same time, also like now I've been in practice 6 years, and I'm like, it seems like, I kind of feel like I remember being an undergrad, and now like so many years have passed by since then. So that's really just the end of it. Again, I just wanted to thank Medical Marvels Official for having me. And if you have any questions, you can email me for sure. I was found through Instagram. I kind of like talk about a lot of like different topics. Some of them are fun. Some of them, I like to talk a lot about mental health as well too. So you're like more than welcome to follow me. You can like send me an instant message there as well too, if that's more convenient. And like I said, I'm happy to take any questions. I'm gonna try to end the presentation and see. I feel like I'm like not really good with technology. Oops. I feel like now I'm like not as good with technology as I used to be. So give me a second, see if I can try to get to it. I think I saw some questions, but I just like didn't know. Okay, let's see where we are. I'm going to see if I can try to answer questions. I saw them sort of coming. So first one was, when applying, do they prefer research you've done to be science-based, or are social research studies acceptable? I would say anything, to be honest. So even when I I was applying to family medicine, my research project was in thoracic surgery, which had really nothing to do with family medicine. And again, it was like just because I got a fluke opportunity to sort of do it, and so I thought it was a great opportunity to work with someone. I think my best advice would be to pick something that you're like passionate about. So if that's kind of where your area of interest is, I would totally do that. Again, I hate to comment on like generalize it I'm not always sure if in different schools that may be relevant or not, but personally I think, because I've been involved in the process of like actually interviewing students and stuff too, and I don't know, for me I feel like most people are like, even interviewers are more interested in like understanding like who you are and why you are, and picking what you do, rather than just being like a very like textbook perfect person of like yes they have this, yes they have this, yes they have this. I think it's like more important to be like more balanced out. And in fact, like sometimes when you do stuff outside of medicine, it actually teaches you something else. So you can say like how that teaches you different aspects, and then how you can bring that into medicine. So personally, I think that would be great. So next question was, you mentioned you speak other languages. How often were you able to use them with your patients? Do you think it helped you grow? Totally. So in Ottawa is the capital of Canada, and the second official language is French. I was actually born in Montreal, which is, most people speak French there. So I was really lucky to be able to have that was probably my first language more than English. And in Ottawa, I used it a lot more, where there was a children's hospital that was like on the borderline of Quebec, which is like where the French area is and where I lived. And there was a lot of French speaking patients. So there's a lot of times where I had to like bust out my French, where I was like, oh, I don't know how to say like gallbladder in French, but like you just sort of like make through, and so really helpful. Now I don't really speak French as much, but there's a couple of patients I have who are from different parts of Africa who speak only French. So I have sometimes like for now, because I just don't practice it as much, I'd definitely find I would love to be able to relearn it a little bit better. We don't, in Canada, I do have Spanish speaking patients for sure, but it's not as strong as I know, not as strong as it is in the States. I actually work, I do a volunteer position once a month, which is I work at a free medical clinic. So these are people who are mostly immigrants or families, parents or grandparents of someone who lives in Canada. And a lot of them happen to be in the area that I'm living in, happen to speak the same language as I do. So I speak to them these are basically it's like speaking to your grandmother basically in my native tongue. So being totally helpful. And then they just get so much happier just being able to speak to you in the same language. And it just, that you can really help them, as opposed to struggling if you can't. Okay. Which specialty do you think has the least procedural work? Okay, good question. So if you don't to be fair, if you in family medicine, you can do no procedural work if you want to. That's what I think I really liked about family medicine is I liked procedural work, so that's great. But yeah, so I mean, immunizations, I don't even really do them. The nurses do them. So, I mean, you can do them if that's something, if you like to give needles, sure, but I don't do that. Sutures, I barely ever do them anymore, though I really enjoyed doing it when I was a student. It's just, you know, if someone comes in, like if they have a cut or like something that's sort of a big enough something that they need to get sutures, most of them just go to the hospital. If you see someone in your clinic more than like 4 hours away from when we've had the injury, it's kind of useless to suture them anyways. Um, I have friends who like work in family medicine and they don't like, you know, they don't like procedural stuff. So, you know, they refer if they have a skin tag or they have something that they just don't feel comfortable doing, they just send them off. So like, I think that you could totally, I'm trying to think what other ones, I mean, like, I think psychiatry, if you're a psychiatrist, you're probably doing zero procedural work. I don't know if I would pick, a specialty just on like whether it has the least amount of procedural work. I would just pick something that like you overall like, and then, you know, um, again, I think in well, actually, you know, a lot of, as at the university, you're making me think through the question, internal medicine, like, you know, if you're like a, you know, like a cardiologist, there's some interventional cardiologists, they do like a lot of procedural work, but then some cardiologists, like they're just seeing people after they have heart attacks and they're just like adjusting their medications and stuff. They don't do any procedural work as well too. So I would just, like, I feel like that procedural work, I mean, if you're not a procedural person, you probably just won't pick a surgical specialty. Other than that, I feel like a lot of them, you can kind of get away without doing that. Okay, so what tips, so the next question is, what tips do you have when working in medicine? What did you incorporate that made you enjoy it to its fullest? I think it's probably balancing doing stuff outside of medicine that helped me enjoy medicine the most. Because I like, to be fair, I really enjoy medicine, but like for example, I'll see like a lot of doctors on Instagram who like they live, breathe, and like everything's medicine. So like, I mean, they write about medicine, they write about like the COVID trials, and they write like, and I find like I need a break from medicine to enjoy medicine. I feel like I just can't, you know, even when I was in medical school, like I was lucky because I was in the same city where I'd grown up. So I had friends outside of medicine. And so, you know, when we would hang out, I didn't want to talk about medicine at all. I wanted to talk about, I don't know, like whatever movie was out, or like go play a game, or like, you know, just find out what's going on in their life, or, you know, do things I'm passionate about. For me, like personally, like I find yoga, but also dancing, I feel like for me, I enjoy it. So when I'm there in that creative space, like I'm totally like all my worries are kind of out. And then when I can come back into medicine, I'm like fully engaged and I like love it. So for me, that's, I think works. Some people just can be engrossed in it all the time. I don't think it's me. How do you recommend applying to medical school with a low GPA? A good question. So, I mean, I don't know the exact, every school will have a different cutoff. So, I mean, some of them you can't really prevent. I mean, to be fair, when I applied, you know, my MCAT score was like pretty borderline, and I did, like I said, really well on like 3 or 4 of the areas, and one I don't know, just bombed it. So, and I still got into medical school, and it just like, you know, certain schools like the MCAT score was more important and some weren't. So I would look at like different schools and what like minimum GPAs they need, and you can probably find certain schools that are more willing to take on people, but then I would just try to see if you can be as well balanced in any other aspect. You know, like again, if you're like, if you're applying and you're writing that personal statement, you're going to say like, they're going to probably ask you like, you know, you might even take that as an opportunity to actually explain it. Like, you know, I wasn't able to do as well as they would have liked because, I mean, to be honest, like anything can happen in life. You could have it like a sick parent, you could have had like a personal thing, you know, so, you know, sometimes, you know, I think that's taken into consideration. So if you can kind of like write down what your reasoning was to be able that you had the low GPA, and sometimes people have like their own learning disability, these are lots of other things. And the other thing would be, you know, if it's too low, would you consider like redoing some courses as well too? So, I mean, like trying to bring up your GPA. So it's a little bit of a fine balance, I think, between kind of all of it. But like, I would look at different schools and like what they're kind of each looking for. Oh, yeah, no problem. It's okay. Someone had to leave, but that's okay. And then I guess that's it.
Yep. Okay. Thank you so much for speaking with us
Yeah,
today.
no
Your
problem.
open mindset on like new
Yeah,
opportunities in life
yeah.
and just life in general too is so inspiring. So, and I also really loved your clinical pearls. They were very helpful.
Good. I'm glad.
So thank you so much for coming.
No problem. I was, like I said, it's a pleasure. And, like I remember going through the process. And so like I try to like think back to kind of like what kind of questions I had. So like I said, like I'm happy to help out. And if you guys ever have any questions or you want to reach out to me, more than welcome to do so.
Thank you.
Thank
Okay. Have a
you.
great rest of the
Nice
day.
rest of the day.
Thanks.